Hello and welcome. I'm YCY, and today we have something exciting to share with you. Let's dive right in. Sleep is not merely a period of rest for the body after a long day, it is a crucial phase for recovery and energy regeneration. For individuals grappling with chronic back pain or spinal degeneration, a good night's sleep in the correct posture can make a significant difference. It can help reduce pain, improve mobility, and enhance overall quality of life. Conversely, an improper sleeping position can inadvertently exacerbate symptoms, leading to persistent and more severe discomfort. Spinal degeneration is a natural aging process of the spine where the intervertebral discs lose hydration and wear down, and bone spurs may develop on the vertebrae. This condition causes pain, stiffness, and limited movement. Back pain, whether due to degeneration or other causes like muscle strain or disc herniation, also severely impacts daily activities. This article will delve into an analysis of recommended sleeping positions, those to avoid, and the vital role of pillows and mattresses in supporting the spine. Why sleeping posture is crucial for individuals with back pain and spinal degeneration. Our spine is not a straight rod but possesses natural curves in the cervical, thoracic, and lumbar regions. These curves help distribute body weight evenly, absorb shock, and allow for flexible movement. When we sleep, the goal is to maintain these natural curves, keeping the spine in a neutral position, free from twisting or excessive pressure. Pressure on discs and joints. An unsuitable sleeping posture can exert uneven pressure on the intervertebral discs, the cartilaginous cushions between vertebrae. This can increase the risk of disc bulging or herniation, especially in individuals already showing signs of degeneration. The facet joints at the back of the spine can also become compressed or overly stretched, causing pain and inflammation. Muscle and ligament strain. When the spine is not held in a neutral position, the surrounding muscles and ligaments must work harder to try and stabilize it. This prolonged tension overnight can lead to muscle stiffness, warning aches, and restricted range of motion. Nerve compression. Incorrect sleeping postures can narrow the intervertebral foramina, the openings where nerve roots exit the spinal canal, or apply direct pressure to nerves. This can lead to symptoms such as radiating pain, numbness, tingling, or muscle weakness in the arms or legs. This is a common issue for individuals with spinal degeneration who may have spinal stenosis or bone spurs. Sleep disruption and a vicious cycle. Back pain and spinal degeneration often cause difficulty sleeping. When sleep is insufficient or disrupted, the body does not have enough time to repair and restore damaged tissues. Conversely, pain makes it hard for sufferers to find a comfortable position, further deteriorating sleep quality. This creates a vicious cycle. Pain causes sleep loss, and sleep loss exacerbates the pain. Therefore, choosing the right sleeping posture, combined with the use of appropriate pillows and mattresses, is an indispensable part of managing back pain and slowing the progression of spinal degeneration. Recommended sleeping positions to alleviate back pain and support spinal degeneration. There isn't a single, perfect, sleeping position for everyone, as it depends on an individual's specific condition. However, certain postures are widely recognized as being better for the spine. 1. Supine position. Benefits. Even weight distribution. This is often considered the best position because it helps distribute body weight most evenly across the entire back surface, minimizing pressure points. Maintains spinal alignment. When lying supine correctly, the head, neck, and spine can easily be maintained in a neutral, aligned position. Reduces acid reflux risk. Sleeping on your back with your head slightly elevated above your stomach can help prevent acid reflux. How to optimize head pillow. Use a pillow of moderate thickness, sufficient to support the natural curve of your neck and keep your head aligned with your spine, not tilted too far back or flexed too far forward. A pillow that is too high will push your chin towards your chest, straining your neck and upper back. A pillow that is too low or no pillow will cause your head to tilt backward. Pillow under the knees. Place a small pillow or rolled towel under the hollow of your knees. This helps to flatten the lumbar curve slightly, reducing pressure on the lumbar spine and sacroiliac joints. It also helps relax the muscles in the hips and thighs. Note: for cervical spine degeneration, special attention should be paid to the head pillow. Memory foam pillows or contour pillows designed to support the neck can be beneficial. Limitations: this position can worsen sleep apnea or snoring in some individuals. 2. Side-lying position. Benefits: keeps the spine relatively straight. If properly supported, the side-lying position can keep the spine elongated and relatively straight. Reduces snoring and sleep apnea. This is the recommended position for individuals with these issues. Good for pregnant women. Lying on the left side helps improve blood circulation for both mother and fetus. Beneficial for spinal stenosis. A slightly curled side-lying position, often called the fetal position, can help open up space within the spinal canal, reducing nerve compression. How to optimize head pillow. Choose a pillow thick enough to fill the space between your ear and shoulder, keeping your head and neck aligned with the rest of your spine. If the pillow is too thin, your head will tilt down. If too thick, your head will be pushed up. Pillow between the knees. This is a key element. Place a pillow, not too thick, between your knees and draw your knees slightly up towards your chest, but not excessively curled like a tight fetal position unless specifically needed. This helps keep your hips, pelvis, and spine aligned, preventing the upper leg from pulling the spine out of alignment and reducing stress on the lower back and hips. Hugging a pillow. Some people find it more comfortable to hug a pillow in front of their chest, which helps keep the shoulders stable and reduces pressure on the lower shoulder. Which side to lie on? There's no strict rule. Lying on the left side is often considered better for digestion and circulation. However, personal comfort is paramount. If one side causes pain, try switching to the other. Variation: fetal position. Draw your knees higher up towards your chest and slightly bend your torso. This position can be particularly helpful for individuals with a herniated disc or spinal stenosis as it helps to open the spaces between vertebrae. However, avoid curling up too tightly as it can restrict deep breathing and strain joints. 3. Comparing supine and side-lying positions. Both of these positions are significantly better than sleeping on your stomach. The choice between lying on your back or your side depends on personal preference and specific health conditions. Supine, best for overall spinal alignment but may not be suitable for those who snore or have sleep apnea. Side-lying, good for snorers, individuals with sleep apnea, pregnant women, and those with spinal stenosis. Proper pillow use is crucial to avoid spinal misalignment. The important thing is to experiment and listen to your body to find the position that provides the most comfort and pain relief. Part 3. Sleeping positions to avoid or adjust carefully. Prone position. This is generally considered the worst sleeping position for the spine, especially for individuals with back or neck problems. Why it's not recommended: flattens the natural lumbar curve. Lying prone can put excessive strain on the lower back, increasing the lordosis or arch of the spine, causes neck strain and twisting. To breathe, you are forced to turn your head to one side for extended periods. This creates imbalance, strains neck muscles, and can lead to neck pain, headaches, and even nerve compression in the neck. Over time, it can contribute to cervical spine degeneration. Increases pressure on internal organs. If you must sleep prone, although not encouraged, if you cannot break this habit, try the following adjustments to minimize harm. Use no head pillow or a very thin one. This helps keep your head and neck somewhat closer to a neutral position. Place a thin pillow under your lower abdomen and pelvis. This can help alleviate some of the pressure on your lumbar spine, attempting to maintain a more natural curve. Try to transition to another position. Be patient and try to get used to sleeping on your side or back, perhaps starting by using multiple support pillows to create a sense of security and comfort. Giving up a deeply ingrained sleeping habit can take time, but the long-term health benefits for your spine are well worth the effort. Part 4. The role of pillows and mattresses in supporting sleep. Besides sleeping posture, pillows and mattresses play an extremely important role in supporting the spine and ensuring quality sleep. 1. Choosing the right pillow. The main goal of a pillow is to support the head and neck, keeping them aligned with the spine. Head pillow, material, memory foam, natural latex, down feathers, synthetic fiberfill. Memory foam and latex are often favored for their ability to conform to the neck's curve and maintain their shape, providing stable support. Height and firmness. If you sleep on your back, choose a pillow of moderate thickness, possibly with a depression in the middle for your head to rest and a thicker edge to support your neck. The pillow should not be so high that your chin is forced towards your chest. If you sleep on your side, choose a thicker pillow to fill the space between your ear and the outer surface of your shoulder, keeping the cervical spine straight. Medium to firm firmness is usually best. If you sleep on your stomach, use a very thin pillow or no pillow at all. Specialized pillows. There are pillows specifically designed for people with neck pain, such as cervical pillows with contours to support the neck. Support pillows. Pillow under the knees, helps reduce pressure on the lower back. Pillow between the knees, helps keep hips and spine aligned. Body pillow, can be helpful for side sleepers, providing support for the entire body, especially the hips and shoulders. Lumbar support pillow. Some back sleepers may find more comfort by placing a thin pillow or small roll towel under the small of their back to support the natural curve. 2. Choosing the ideal mattress. A good mattress should support your body in a neutral position, meaning the natural curves of your spine are maintained and the spine is aligned. Firmness, not too soft. A mattress that is too soft will cause your body to sink, leading to a sagging spine, muscle strain, and back pain. Not too hard. A mattress that is too hard will create pressure on contact points like shoulders and hips, failing to support the spinal curves, causing discomfort and aches. Medium firm, often recommended by experts. Research suggests that a medium firm to firm mattress is generally best for people with back pain. However, the perception of firmness is subjective and also depends on body weight. Heavier individuals may need a slightly firmer mattress. Mattress material. In a spring mattress, various types exist, such as Spinal coils and pocketed coils. Pocketed coils are generally better as they reduce motion transfer and provide more targeted support to different body zones. Memory foam mattress conforms to body contours, providing good pressure relief. However, some types can retain heat. Natural latex mattress, durable, breathable, good elasticity, and supportive. Often more expensive. Hybrid mattress, combines springs with layers of foam or latex, aiming to leverage the advantages of different materials, mattress lifespan and when to replace. Most mattresses have a lifespan of 7 to 10 years. If your mattress sags in the middle, creaks, or you consistently wake up with more back pain, it might be a sign that you need a new mattress. Try before you buy. If possible, lie on the mattress in the store for at least 10 to 15 minutes in your usual sleeping position. Many companies now also offer at-home trial periods. Part 5. Other supporting factors to improve sleep and reduce back pain. In addition to sleeping posture, pillows, and mattresses, several other habits and factors contribute significantly. Proper technique for getting in and out of bed. Getting into bed, sit on the edge of the bed, then use your hands for support, slowly lean over, and simultaneously bring your legs onto the bed. Getting out of bed, lie on your side facing the edge of the bed, bend your knees, use your hands to push your upper body up, and slowly lower your legs to the floor. Avoid sudden movements or bending forward from a supine position. Daily lifestyle habits, regular exercise. Exercises that strengthen core muscles and stretching exercises can improve spinal stability and reduce pain. Yoga, Pilates, and swimming are good options. Maintain a healthy weight. Being overweight or obese puts extra pressure on the spine, especially the lumbar region. Practice good posture during the day. Pay attention to your posture when sitting at work, standing, and lifting heavy objects. Use an ergonomic chair and take frequent breaks to move around. Relaxation before sleep, a warm bath, reading a book, listening to soft music, meditation, or deep breathing exercises can help relax muscles and mind, making it easier to fall asleep. Avoid using electronic devices like phones and computers at least 1 hour before bed, as blue light can interfere with melatonin production. Nutrition, a balanced diet rich in anti-inflammatory foods such as fatty fish, green vegetables, fruits, and nuts can support overall bone and joint health. Part 6. When to see a doctor. Although adjusting sleeping posture and lifestyle factors can significantly reduce back pain, there are instances when you need to seek professional medical advice. Severe back pain that lasts for more than a few weeks and does not improve with self-care. Pain that radiates down your leg, especially if it extends beyond the knee. The appearance of neurological symptoms such as numbness, weakness, or tingling in the legs or feet. Back pain accompanied by fever, unexplained weight loss, or problems with bladder, bowel control. Back pain following an injury. A doctor can accurately diagnose the cause of your pain and recommend appropriate treatments, including physical therapy, medication, or other interventions if necessary. Conclusion. Sleeping posture plays a pivotal role in managing back pain and supporting spinal health, especially for individuals with spinal degeneration. By choosing a supine or side-lying position with appropriate support from pillows and a mattress, you can significantly reduce pressure on your spine, allowing muscles and ligaments to relax and recover overnight. Be patient and experiment to find the optimal combination for yourself. Investing in quality sleep is an investment in your long-term health, helping you wake up each morning feeling refreshed and with less pain. Thank you for watching. I hope you found this helpful and enjoyable. Don't forget to follow for more, and I'll see you in the next one. Take care.